Premier will be in just a moment. He'll have just a couple opening remarks, and then it's open Q&A.
Thank you.
Do we have any? No? No we? Cool camera?
Yeah.
Okay. Yep, we got cool camera.
Stretching out. Is it going to be that rough? Oops. Supposed to snow this afternoon, I hear. Is it? Pardon me?
Well, my dad.
Oh,
He's working there.
Oh.
Whenever you're ready, Colonel.
Are we waiting for Wayne or?
We got cool camera here.
Oh, okay. Okay. I was going to talk more about the weather, snowmobiling, and all the good things we can do. Everybody ready? Well, thank you everybody for coming here this afternoon. Today, more than 2.3 million COVID-19 vaccinations have been administered in Saskatchewan. Has gotten us to a point where those 12 and over, we have an 85% fully vaccinated rate. Our entire population is 75% fully vaccinated rate. We have 48% of those 12 and over have their booster shot. That's among the highest in Canada, and likely even more impactful than that is of our Saskatchewan residents aged 60 and over, 75% of them have went out and gotten their booster shot. It puts us in a strong position as we find our way through the Omicron wave. This is good news, as vaccines do reduce the likelihood that people would experience severe outcomes due to COVID. And it's good news because Saskatchewan people have consciously made the choice to go out and get vaccinated in large numbers. Saskatchewan has never had a vaccination mandate per se, but we have had the proof of vaccination or the proof of the negative test requirement in place since the Delta wave that we experienced last fall. This difference from the federal vaccine mandate that is you either get vaccinated or you ultimately lose your job. The requirement that we had in Saskatchewan with the proof of vaccination or the option for the proof of negative test had two goals. One was to convince additional people to go out to make it a priority and go out and get vaccinated, and two was to reduce transmission of COVID. And I would say that it's been very effective on both counts, in particular as with the Delta variant. But now, in light of the Omicron wave that we're facing, it is incumbent for us to adapt, as it's quite obvious that the virus itself has adapted. Omicron transmits among vaccinated and unvaccinated individuals quite freely. Over the past week, for example, we've had 78% of our new cases were in those folks who were fully vaccinated. Many of them have also received their booster dose. I would be an example of that. I received 3 doses. I contracted the Omicron variant. We see today that the Prime Minister, also an individual with 3 doses, has contracted the Omicron variant. So 78% of new cases over the course of the past week were in individuals that would be considered fully vaccinated. As I said earlier, 75% of our population is fully vaccinated. The bottom line of all of this is that vaccines do work, but they are no longer working at preventing transmission in this wave of COVID-19 like they previously did in the Delta wave, at which they were quite effective. And that is why the proof of vaccination or the proof of negative test requirement that we have in Saskatchewan will very soon come to an end. Public health experts, including our Chief Medical Health Officer, Dr. Shahab, has signaled that Saskatchewan is near the peak of the Omicron wave and that we will see the pressure reduced on our healthcare system in the weeks to come. Day in and day out, for almost 2 years now, Saskatchewan people have done what we and health professionals have asked them to do. They have followed all of the public health measures when they are implemented and when they have been necessary. They have gone out and gotten vaccinated. 75% of our entire population, 85% of those that are eligible have went out and gotten vaccinated. They are utilizing rapid tests, and I would say that in Saskatchewan we are utilizing the supply of rapid tests that we have unlike anywhere else in Canada. and that is a good thing. Saskatchewan people are also aware of, and they are utilizing, when it is necessary, any early intervention treatment, such as monoclonal antibodies, such as ultimately Paxlovid, that is now available and being administered here now in the province. So now, and our caucus MLAs are hearing this from the people that they are talking to across the province and the people that they ultimately represent, and people are asking their government for a return to normal, a removal of public health restrictions, and we most certainly are looking at how we can do that in the weeks ahead here in Saskatchewan. And now I think it is, in fairness, it is time for us as a government to do what Saskatchewan people are asking for. Public Health will have more to say on how we are going to continue our steps towards living with COVID in the days ahead. As I understand, they will make themselves available later this week. But now I would take any questions if there are any.
Premier, we saw the desecration of the National War Memorial in Ottawa over the weekend. There was Nazi imagery, there was more really frankly bad imagery out there. You kind of threw your support behind the people of this convoy on the weekend, so do you condemn those actions specifically that were taken in Ottawa on Saturday?
Yeah, absolutely. And the individuals that have done these actions, that you know, whether it's dancing on the tomb of the unknown soldier, whether it's you know, putting flags and such on Terry Fox, a very icon of this nation, whether it's you know, harassing people in any business, in particular people that might be working in a homeless shelter. These people should be held accountable. If the acts that they have performed are illegal, I would hope that the RCMP, or the OPP in this case, or whoever the law enforcement agency is, would ultimately hold these individuals accountable. And I would go a step further to say that what these individuals are doing, they owe Canadians an apology. It's absolutely despicable that we see people doing this. It takes away from the broader message that the vast majority of law-abiding folks that are participating in whether it be the Ottawa rally, this rally we saw here in Regina, or numerous other communities across the province as well. It takes away from the message that they are conveying is that vaccine mandates are not working, vaccine mandates are not necessary, and they're something they'd like the federal government to remove. Ours is very different. In Saskatchewan, we have the proof of negative test option, and we've signaled that we will be ultimately removing that in the days ahead. We've seen these type of actions by individuals at previous you know, previous gatherings at various times. If we look back in history, and we should always remember that when an individual performs a despicable act, like we are seeing here, or like, quite frankly, when we saw a number of people in front of this building having their voices heard on a very important topic. We saw one individual ultimately spray paint over the names of soldiers that have given their life to this country and this province on our war memorial here in Regina. Also a despicable act, also an individual that should ultimately be held accountable for that act, but it is in no way should detract from the message that was being brought forward and heard on that particular day, and the same holds true today.
Actions of the bad people, but what about the silence and indifference of the good people, including yourself, because many are not commenting on the actions or standing up against the actions unless they're prompted by the media through questions. So what about the, you know, silence and indifference that we're seeing from the standardized?
Anyone, when they see someone that's doing something that is you know, discriminatory, whether it is something that ultimately is you know, a despicable act like what we have been discussing here today, whether and if it's an illegal act, they should step in. And I won't ascertain between good and bad people, but most certainly we should step in and we should stop some of the actions that we have ultimately seen. We've all seen them on the news, but us also as individuals, and you ultimately as the media, we should always be separating out individual actions from the, you know, the broader message that people want to bring. And we see a number of those messages on various topics that come and arrive at the front of this building. We saw a large one this weekend with the what started with truckers, but I can assure you that in addition to truckers out front of this building this weekend, there was teachers, there was nurses, there was other healthcare workers, there was welders, there was frontline workers in our retail businesses from across the province, and that's why we communicated with them our support for that broader initiative and our support, and what ultimately we are hearing from Saskatchewan people is that as we find our way to living with COVID, part of that is going to be reducing the public health measures that we have in place, and we're taking a very bold but responsible view as to when we're going to be able to do that.
We've seen a few doctors in Saskatchewan now, Dr. Alex Wong, Saskatchewan Medical Association, take issue with some of the things you said in the letter that you published on Saturday, specifically with your comments on vaccines not preventing infection or transmission. So I guess I'm wondering on what basis you're making those claims, and when these experts are disagreeing with you, and do you think you made a mistake in saying that? And if you did, are you willing to correct the information you put out there?
I think what I'm speaking to is the data that we have in front of us. And what the data is saying ultimately is that the infection rate that we have, the new cases that we have in this province are roughly about the same in vaccinated and unvaccinated people here in Saskatchewan. And so it is not stopping transmission by the data that we have in front of us. And we're being very transparent with Saskatchewan people. Anyone can look at what that data is and make their own assertions, but that is the fact, is the number of people that are getting COVID is roughly the same proportion as the number of people that are vaccinated here in the province. When it comes to severe outcomes, vaccination greatly reduces your chance of having a severe outcome and ultimately possibly ending up in a hospital bed in Saskatchewan. And so I would say again today, like I have virtually every other time I've made myself available, if you haven't been vaccinated yet, you should consider it. It will reduce the symptoms that you may encounter should you contract Omicron. So as we look ahead, understanding that data is there, that is part of the precipitous behind why we look at the proof of vaccination, proof of negative test policy here in Saskatchewan, which is different than the federal policy, markedly different than the federal policy. It has run its course. It has increased our vaccination rates. It was effective at reducing transmission during the Delta wave. However, it doesn't appear to be reducing transmission with respect to the Omicron wave that we have here today. And for anyone to say different is quite frankly just not the case.
Doctors and experts, they probably have more context than you and I, given their background in this. So if they're saying that that's incorrect, that it actually does help with stopping transmission, shouldn't, I guess, they be deferred to?
I just looking at the data, and what the data tells us is actually we have a few more people that are vaccinated proportionally that have Omicron here today. I'm fully vaccinated plus my booster shot. I still got Omicron. The Prime Minister, fully vaccinated plus his booster shot. He still got Omicron. For every 100 people in Saskatchewan over the course of the past week that got Omicron, 78 of them were vaccinated. And we have about 75% of our overall population is vaccinated. And so it's roughly about the same, in fact, a few more. And I think we need to identify with the facts that are before us, regardless of what we do. If we're a physician or a reporter, we need to identify the facts before us say that vaccinations are not reducing the spread of Omicron, very effective with Delta, but are not reducing the spread of Omicron, but are and continue to reduce the severe outcomes. And so we should still get vaccinated, and I've been an advocate of that from day one. But to report anything outside of what the facts are in Saskatchewan, quite frankly, is irresponsible.
Our reporters understand that, yes, vaccines aren't perfect. There are going to be some breakthrough cases, especially with Omicron, as you alluded to in your opening statement. But there has been studies that show from various countries, including the CDC in America, that vaccines do work up to 60% against contracting the Omicron variant. So what data or study are you basing your information on? Because yes, there are breakthrough cases, but to completely say that it breaks transmission completely, it seems a little misleading to the public.
Well, no, I don't know how much more clear I can be. I base it on last week's data in Saskatchewan. We have more people that are, our proportion of people that are getting Omicron in Saskatchewan is slightly higher than the proportion of people that are vaccinated. I don't know how else to to say that any more clear. And so that's what we're seeing here in Saskatchewan. But as I say, it's still important because it's reducing the severe outcomes that we are seeing with Omicron. We have, I believe as of today, 153 the people that are in the hospital with Omicron or due to Omicron. Here today, our hospitalization system has gone up slightly in the past week, and we're watching that quite closely. But and also watching ultimately our absenteeism in our facilities, which has remained relatively similar to last week. And so we are finding our way through this Omicron wave. We have tools available that Saskatchewan people are availing themselves to. Some of those tools are not available in other areas of Canada, and we're thankful that we have them here in Saskatchewan. And what we're saying here today, what I said a number of times last week, is we are going to continually assess the tools that we have, including public health measures, and those that are effective in reducing spread and effective in keeping people out of hospital. We're going to continue to make those available, and those that may have run its course, like the proof of vaccination policy, proof of negative test policy, we're going to look at ultimately removing that. And that's what we're hearing from Saskatchewan people across the board. Government MLAs are hearing that across this province.
Your website, your government warns of misinformation circulating around vaccines and instructs the public to seek science-based sources. So why are you departing from that government message, and how come Dr. Shahab is not in front of us here today, as I have requested an interview with him today, and how come he is not telling us what you are telling us today?
Dr. Shahab will be out, my understanding will be later this week. I had a briefing with Dr. Shahab this morning where we discussed, among many things, what we're discussing here today. And like I said, there's numerous, been numerous comments and various things that have been referenced, whether it be modeling, which is really a number of assumptions that go into predicting what potential outcomes could be. And we had that discussion last week with respect to modeling around excess fatalities due to COVID here in Saskatchewan. And you can bring all of the numbers together, but the fact remains that, and by the author's own admission, I think it started at 7,000 excess fatalities, was reduced on a global interview to 4,000 to 5,000, and then by a tweet to somewhere in the 3,200 range. Modeling is just that. You change some of the assumption, whether it's COVID or climate modeling, quite frankly. If you change the assumptions going into the model, you can wildly change ultimately what the outcome is of that modeling. What we have said is, in the case of modeling, we look at that as one of the tools ultimately that we would utilize in the decision-making process here in Saskatchewan. But we're also going to look at the data. And what I'm saying here today is the data shows that in the case of the Omicron wave, which is unlike the Delta wave, that vaccination does not appear to be preventing contracting Omicron. That was the case with me. But it most certainly does continue to be effective at reducing those severe outcomes. Also the case with me.
Specifically, are you removing the proof of vaccination requirement? Like what date specifically?
I don't have the date here, but it's under consideration, and there's a number of factors that are going into that decision.
Will everything go when you remove that, like masks, all that stuff?
No, I think we haven't made that decision yet, but we have two public health orders, indoor mandatory masking, as well as the proof of vaccination, proof of negative test policy. Both have been renewed to the end of February, February 28th. I think you could look for the proof of vaccination, the date for the termination of the proof of vaccination policy to be that or to be pulled forward sometime between now and then.
How much of your government's response to COVID has been based on your observations as opposed to recommendations from experts?
We're in constant discussion, as is our Chief Medical Health Officer, Dr. Shahab, with medical experts, with scientific experts across this province and around the world, as well as mixing those conversations with data ultimately that is available in other provinces and in other areas of the world. And that data has been different depending on which variant each province or / country is ultimately working their way through. We had a significant Delta wave in Saskatchewan last fall, where we had much lower numbers than we're experiencing today, and a very challenging situation when it comes to our hospitalization rate and ultimately our ICU rate that we experienced during that Delta wave. Omicron is very different. We're at a stage today where we have more people vaccinated in Saskatchewan than we ever have before, and we admittedly have some of the highest daily case numbers that we have ever experienced before here in the province as well. What I would say is that as we look ahead and what I'm seeing in communities and what other MLAs are seeing is Saskatchewan people, after 2 years of managing their way through various COVID waves, understand COVID quite well. And they understand the tools that are effective, and they incorporate those tools into their daily risk assessment that each individual ultimately is making. And we have some tools, yes, available here, such as access to rapid tests that are not near as accessible in other areas of Canada, and Saskatchewan people are utilizing that tool, and a credit to them. They are utilizing all of the tools ultimately that we have available here in Saskatchewan, and I think in many ways they are fully prepared to move forward through not only the next number of weeks, but the next period of time, utilizing those tools to do their own personal risk assessment and to continue to keep themselves and those around them as safe as we can through the Omicron wave. Now, should things change and the environment change, we would have to adapt to whatever that looks like. Should a variant show up that has outcomes much more similar to Delta, then we would have to have a very different discussion. But with the Omicron variant that we are facing, we are seeing some public health policies that have ran their course and served us well, but their time has come for review.
I think there's as of today, 363 people in hospital, 42 in ICU. You referenced earlier the fact that Dr. Schwab has indicated that we're almost hitting our peak with Omicron. I don't know, are you referencing his general timeline of that 4-week peak, or have you heard him say that? Because from what I've heard in the past week or so of Schwab speaking, I don't think I haven't heard him say that we're nearing our peak, and those hospitalization numbers are climbing. So I guess I'm just wondering where you're getting this information that we are nearing our peak of Omicron, and that the hospitalizations aren't going to rise to a point where they were with Delta.
I think Dr. Schwab has indicated that the last time he was out, I think I specifically heard him, and in our briefing this morning, that we have neared or actually hit our peak with respect to case numbers, and our case numbers, if they haven't started falling already, should most certainly start falling like they have in virtually every other jurisdiction around the world. And
the honourable member for Carleton.
Well, the problem is they've shown no respect for the people. This country right now is like a raw nerve, and the Prime Minister is jumping up and down on it again and again with his inflammatory rhetoric. We're talking about people who have 14-year-old kids that are suicidal after 2 years of lockdowns. I just spoke to a waitress whose business was wiped out by lockdowns. I'm talking to truckers who've been serving food on our plates throughout this, and these are the very people, honest, hardworking, shirt off your back type of people that this Prime Minister keeps attacking.
The Honourable Government House Leader. We'll wait to start the time. Okay, very good. Please go.
Mr. Speaker, again, I encourage the member to just think about if he's talking about de-escalating and having civil discourse, his tone and how he's approaching this issue. This is a time that is incredibly delicate. We are in a moment where there is a raw nerve that is being touched. How we talk to each other, Mr. Speaker, how we deal with one another.
I'm going to interrupt the Honourable Government House Leader and just wait till everything calms down a moment, and then I'll let him start from the top, because I'm sorry, I didn't have a chance to hear it all, and I'm sure the Honourable Member from Carleton asked a question he wanted to answer to, and he wants to hear it, and we're just not hearing anything because of the noise. The Honourable Government House Leader, please proceed.
I have an instinct, and that instinct is that Canadians expect us today, when they're seeing what's happened over this weekend, to watch the dialogue in this chamber be as respectful as possible, for us to dial down our rhetoric and our language, for us to engage in one another and find an off-ramp from the escalation that has occurred, because this is not healthy. In a healthy democracy, we have respectful debates that don't involve some of the things that we've seen. And all I'm asking for is for us to engage in a constructive way. So if we could attempt in this place, in this hour, to be equal to that, I hope that we can move forward on that basis, Mr. Speaker.
Well, member for Carleton.
Well, I couldn't agree more. And Mr. Speaker, I was out at an overpass as the truckers went by. And what I saw were cheerful, patriotic, optimistic Canadians who want their freedom back and want their livelihoods back. And they're standing up for their fellow Canadians, the 60% of families who fear they can't feed themselves. The 28-year-old kid living in mom's basement because he can't afford a home. The small businessman wiped out by endless lockdowns by incompetent politicians. These are the people that are standing up and fighting for their livelihoods and their freedom. Why won't the government finally stand with them?
The Honourable Government House Leader.
Mr. Speaker, I have a fundamental difference, and that is that I don't believe that my enemy is across the aisle. I believe that our enemy is this pandemic, and that our enemy is ending this pandemic and getting everybody to get vaccinated and to move forward in a way where the concerns that he's talking about, being affected by a global crisis, means that they are supported. This is a time of collective trauma. It requires us to be compassionate, to work with another, and understand that our common enemy is the virus and not one another.
Yes.
The Honourable Member for Lac-Saint-Jean. Mr. Speaker, Friday will be the opening ceremony of the Beijing Olympics. The whole world will be celebrating the greatness of China while it's committing genocide against its own people, the Uyghurs. Mr. Speaker, we should not blame the athletes. They are not the ones who decided to encourage the games to be held in China. It's this government. Can this government at least have the courage to finally recognize that what is happening in China is true and that the Uyghur people are being subject to genocide? The Honourable Minister of Sport. Mr. Speaker, I'd like to thank my colleague for his question, which allows me to speak for the first time in this House, and thank the constituents of my riding. Mr. Speaker, the decision whether to participate in the Olympics or not in China was first and foremost up to the Olympic Committee and the Paralympic committees. Athletes in other countries as well have decided to send their athletes to participate in the Chinese Olympics. The government sent a clear and coherent message. We've always defended this. We are in favor of democracy, and that is why, in cooperation with our allies, we are not sending an official delegation to China. The Honourable Member for Lac-Saint-Jean. Mr. Speaker, it's curious. Canada is participating in a diplomatic boycott of the Games, but they're not even able to tell us why. They don't have the courage to tell us because China is committing genocide against the Uyghur people. They don't want us to investigate this. They don't want us to delay or move the Games. They accepted diplomatic boycott, but they refuse to tell us why. Is this what the Prime Minister had in mind when he told the world that Canada is back? Is that what he meant by that? The Honourable Minister of Foreign Affairs. Mr. Speaker, I take the allegations of genocide in China against the Uyghur people very seriously, and that is why we've always shared these concerns, and that is why we have decided not to send a diplomatic delegation to the Olympic Games that start Friday, and that's why we asked the Human Rights Commission at the UN to investigate the situation. So I'd like to correct my colleague when he says that we won't investigate it. That's not true. On the contrary, we want to shed full light on this issue because it's very concerning. Thank you very much.
Kelowna Lake Country.
Mr. Speaker, last month the Associate Finance Minister said that when it came to payroll tax hikes, that, quote, businesses can afford this. How completely out of touch is this comment with small businesses, considering they went ahead with these tax hikes despite 30-year record high inflation rates? We have to assume this government believes that businesses can afford these as well. So to the minister, how historically high do inflation rates have to be before this government stops increasing taxes on small businesses?
The Honourable Deputy Prime Minister.
Mr. Speaker, when it comes to supporting small businesses, it is a bit rich of the Conservatives to presume to offer our government any advice at all. After all, before before Christmas, when the Omicron wave was rising, it was these Conservatives who opposed Bill C-2, a bill which included a lockdown insurance policy for small businesses and Canadians. The Conservatives voted against it. Thank goodness they failed. Otherwise, our small businesses today would have no support.
The honourable member for Hastings, Lennox and Addington.
Mr. Speaker, record inflation, coupled with this government's brutal GIS clawback, has financially crippled many of Canada's hardworking seniors. Forced to spend their golden years in the labour market just to make ends meet. Our vulnerable seniors need to know that Ottawa is listening. That is why our Conservative opposition called on this government to reverse the CPP tax hike. Mr. Speaker, when will this government stand up, rise up, lean in to Canada's hardworking seniors and help them meet their basic...
Honourable Minister.
Mr. Speaker, seniors have worked all their lives and they deserve to feel safe and financially secure later in their life. That is why, Mr. Speaker, our government is delivering on our promise to increase the OAS by 10% for those 75 and older, strengthening the support for all Canadians later in life. Since 2015, Mr. Speaker, we have restored the age of eligibility for OAS to 65. We have increased the GIS for single seniors and strengthened the CPP. During the pandemic, we provided direct and immediate support for seniors, Mr. Speaker, and as always, we will be there for them.
The honourable member for Brantford-Brant.
Mr. Speaker, with inflation reaching a 30-year high, the government continues to hurt Canadians with its poor economic policies. Nearly 60% of people are finding it difficult to feed their families. And if that's not bad enough, the government raised its CPP tax on Canadians, an extra $700 coming out of families' paychecks. Now, this may mean nothing to this Prime Minister, but it matters to everybody else. When will the government reverse its CPP tax and stop penalizing hardworking families?
The Honourable Deputy Prime Minister.
Mr. Speaker, the Conservatives continue to irresponsibly perpetuate a false economic narrative and talk down the Canadian economy. The reality is that Canada is resilient and our economy is robustly recovering from the COVID recession. In Q3, our GDP grew by 5.4%. That was beating the US, Japan, the UK, and Australia. We have recovered 108% of jobs lost to the pandemic, compared to just 84% in the US. And we had, in November, a trade surplus at a 13-year high, Mr. Speaker.
The honourable member for Kings Hants.
Monsieur le Président, en décembre...
Mr. Speaker, in December, the Minister of the Environment and Climate Change announced a consultation process on our new climate commitments. The Minister also confirmed that he will table, by the end of March 2022, Canada's 2030 emissions reduction plan. Can the Minister inform this House on how our government will build a strong foundation to achieve net zero by 2050? The Honourable Minister. Thank you, Mr. Speaker. First, I'd like to congratulate my colleague for his ongoing efforts to speak French in this House. And our government in the past few years has invested billions in climate change efforts, and there will be many new components in our new legislation, including zero emission efforts, as well as a ceiling on GES emissions.
Vaughan.
Thank you, Mr. Speaker. Many in Canada's labour force are senior citizens, struggling to get by. Many seniors are forced to work beyond the retirement age, to no fault of their own. The CPP tax hike is added insult to injury to our seniors who have worked hard their whole life. The out-of-control inflation has many working seniors feeling like retirement is a dream they will never have the ability to experience. When will this government reverse the CPP hikes for our seniors? Thank you.
The Honourable Minister.
Speaker, since 2015, our government has been strengthening retirement support for seniors today and for future retirees. We have built a strong social and pension system that all Canadians, Mr. Speaker, can be proud of. We have enhanced the CPP, the OAS, and raised GIS for single seniors that has helped 900,000 low-income single seniors, Mr. Speaker. We're helping investing in services such as $70 million for New Horizons for Seniors program, billions into home care, Mr. Speaker. We're going to make sure that seniors now and into the future have all the supports that they need. Thank you.
Member for Edmonton Riverbend.
Mr. Speaker, CMHC is a federal agency funded by this housing minister using taxpayer dollars. So recently, CMHC funds a study that determined the best course of action: tax Canadian homeowners more. Now, why should Canadians be concerned about this, Mr. Speaker? Because this government continues to float the idea of adding more taxes on Canadian homeowners. On this side of the House, Mr. Speaker, we are 100% against this tax. Why does this minister continue to support the idea of adding more taxes on Canadian homeowners?
The Honourable Minister for Housing.
Gives me another opportunity to once again state categorically that our government is not considering charging capital gains or surge taxes on primary residences. We've said this time and time again in the House of Commons and in the public sphere. And the party opposite continues to engage in misinformation. We are busy focused on the work of ensuring that each and every Canadian has a safe and affordable place to call home.
The Honourable Member for Portneuf-Jacques-Cartier. Thank you, Mr. Speaker. We want our businesses to believe in the future of our country and to invest and continue operating their businesses. Programs have been established to help our entrepreneurs during this crisis, but there are some companies that don't have access to this assistance when they open their businesses in July 2022. They're part of the economic recovery, but nothing is there for them. What is the Minister of Finance going to do to support these entrepreneurs and save their businesses? The Honourable Deputy Prime Minister. Mr. Speaker, once again, I have to stress the hypocrisy of the Conservative Party. We know, well, in terms of small businesses in Canada, we saw the rise in the Omicron wave, and we established measures to help and support small businesses in Canada. The Conservatives were against such measures. I'm very happy to be able to help small businesses, and our government was able to support them against. Mr. Speaker, we know that the vaccine is the best way to end this pandemic and to ensure the security of our communities.
Please share with the House the steps our government is taking to safeguard the health of Canadians and Canada's air transportation system. Thank you.
Honourable Minister of Transport.
Thank you very much, Mr. Speaker. I want to thank my colleague for her question. Our government is committed to the public health of our citizens. Mr. Speaker, our leadership requires belief in science. Leadership also requires resolve, and we are resolute to doing everything we can to protect the health and safety of Canadians. That's why we've implemented measures, including requiring travelers to be fully vaccinated, and any allegations of violations of our public health measures will be investigated fully by Transport Canada, Mr. Speaker. Thank you very much.
The Honourable Member for Windsor West.
Mr. Speaker, like many other frontline workers, grocery store workers have put their health at risk to make sure Canadians have been able to get the essentials that they need. With COVID-19 cases high, it's absolutely essential that they are treated and compensated fairly for the work that they do. Big grocery store chains won't do the right thing on their own and restore the hero pay they had promised. They even take government handouts to pay their rich CEOs. If the Liberals won't stand up for these workers, will they at least guarantee that these fat cats won't continue to get taxpayers subsidized money, especially when they promise to make this happen? What will the minister do?
The Honourable Deputy Prime Minister.
Thank Thank you very much, Mr. Speaker, and I would like to thank the member opposite for reminding us yet again that COVID has really shown us who are the truly essential workers in our economy, and that very much includes frontline workers in places like grocery stores. Our government is very pleased to have been able to put measures in place throughout COVID to support these workers, including measures like paid sick leave, including measures like government support for people who need to take time off if a loved one is sick, and of course the increase in the Canada Workers Benefit.
Absolutely. The honourable member for Kitchener Centre.
Mr. Speaker, earlier this month, over 400 climate scientists and scholars co-signed a letter calling on the federal government to step back from its plan to introduce another fossil fuel subsidy, a new tax credit for carbon capture and storage. As stated in their letter, despite decades of research, carbon capture is neither economically sound nor proven at scale. This proposal would only divert resources away from proven and cost-effective solutions like renewable energy and electrification. Can the minister confirm they will listen to scientists and scrap this proposed new subsidy?
The honourable minister. The honourable minister of the environment.
Thank you very much, Mr. Speaker, and thank you to my honourable colleague for his question. We have to look at every possible technologies that will help us reduce greenhouse gas, and in fact, when it comes to carbon capture and storage, the IPCC itself produced a report a few years ago looking at this very technology, saying that we might have to do it because we won't be able to reduce our greenhouse gas emissions fast enough to prevent 1.5 degrees Celsius of global warming, Mr. Speaker. Thank you very much.
That's all the time we have today. C'est tout le temps que nous avons aujourd'hui pour la période de questions.
That's all the time we have for question period today.
Did you have a... No? Okay. No point of order. Do you want to give me my... Excusez, if I can have your attention, si je peux avoir votre attention.
If I can have your attention.
Nous avons un rappel au règlement.
We have a point of order.
Le député de Montcalm.
The honourable member for Montcalm.
Oui, merci, Monsieur le Président.
Yes, thank you, Mr. Speaker. There have been consultations among the parties, and I believe you will find unanimous consent for the following motion. That this House commend the dedication of healthcare workers who have worked tirelessly on the front lines for the past 22 months to administer vaccines and take care of COVID-19 patients. All those opposed to the motion will please say nay.
D'accord. D'accord.
Agreed? The House has heard the terms of the motion. All those opposed to the motion will please say nay.
Adopté.
Carried.
Tabling of documents. Yeah. Il est mon devoir de déposer sur le bureau conformément au...